Good day from Wall Street. This is Juan Costello, Senior Analyst with the Wall Street Analyzer. Joining us today is Serguei Melnik. He's the CEO over at Nutriband Incorporated. The company trades on NASDAQ, ticker symbol NTRB and NTRBW. Thanks for joining us today there, Sergey.
Thank you for having me.
Yeah, starting off, please provide a intro and overview there of the company.
Oh, a brief overview of the company. We went public through a Form 10 in 2016. Most of the legal work we did ourselves, me and my partner Gareth Sheridan. And eventually it culminated with a couple of acquisitions while we're still on OTC QB that led to IPO and NASDAQ uplisting on October 1st, 2021. So this October is going to be 4 years anniversary since our initiation on NASDAQ. We raised a little bit over $6 million. And that was going towards our lead product, AVERSA technology, our platform that can be used for any pain-killing patches on the market today.
So yeah, can you bring us up to speed on the most recent news as you just had a record revenue for Q2?
The revenue comes, we have 3 subsidiaries. Nutriband is the umbrella company. We have 4P Therapeutics that holds the patent for AVERSA. We're 100% owners of that one, and 100% owners of Pocono Pharmaceuticals, our third-party manufacturer that we take orders from such clients as Reebok, KT Tape. Since we acquired the company, we have made significant investments in Pocono Pharmaceuticals, and that allowed us to scale up the production. Besides, we actually have our own line of production, AI tape, and our, for example, our mosquito patches were just approved last year to be sold in Costa Rica, so we started selling our patches in Costa Rica also. So the revenues are derived, so we're like not a typical biotech company that burns through the money and raises money and burns again until they actually hit the jackpot. We have a money-making subsidiary that significantly reduces our burn rate, and that's what makes the difference from any other biotech company on the market today. So yes, revenues went up. We expect it to be trending up also, considering that we're coming up with our own products on the market. We have a lot of endorsements coming up. For example, our advisor to the board of directors was joined by our Olympian from Republic of Moldova. She was a silver medal of the Paris Olympics. So we have a lot of plans for our subsidiary for third-party manufacturing. We don't expect it to be anything, that we expect from our AVERSA technology. I mean but that's going to keep us afloat. And meantime, until we come to the market with our AVERSA technology, that's going to be a very significant input to our, revenue of the company and downsizing the burn rate of the company.
Right. So yeah, can you talk about that transdermal patch when it comes to fentanyl and, fentanyl addiction, or I guess, treatment?
The platform that we have, it's not just a patch. Fentanyl patch is just the first product. It's absolutely unique. There's nothing like this on the market today. We're going to be the only ones once we file with the FDA. We expect the filing to be sometime next year, hopefully by the end of the second quarter. And we just had an FDA meeting, a C-type FDA meeting last week. And it's very optimistic. Looks like we're going to be able to hold all the timeline that we initially had put. Sorry, guys. I have my cat here coming to help me. So the fentanyl patch, the day when it was very interesting. The day when we received October 1st, we did the listing on NASDAQ, but a couple of days before we received the patent. It was very interesting that the day we received the patent, the very day in the United States, we got a call from Kindeva Delivery. And the Kindeva Delivery is a former 3M company. It's a leader in transdermal manufacturing in the US. and they offered us to work on a feasibility to see if we can place our platform, our technology on their patch that's on the market today, on their fentanyl patch. And we eagerly agreed. We did they insisted on a study to be done if it's worth to do it. And we did a study with Advanced Health that came up with first years on the market with that patch. Our revenues are going to be anywhere from 80 to 200 million. Again, that taking consideration 2020 number, 2021 numbers, they have increased already since then. And so Kindeva signed with us the agreement in January of 2022. And just this June, it took longer than we expected. We thought it was going to be about a year to 2 years to complete the project. Just this June, we have finally announced that we do have the product. And we have proven the scale up of the product. And we have proven the platform that it can be applied to any other narcotics patch on the market. And it's going to make it very, very difficult to abuse, misuse, or even make accidents. I mean, we did a radar study, and there are children who died by simply picking up the used fentanyl patch from the trash and placing their mouths. I mean, I'm not talking about the pets. This is a huge problem. So we also, with this technology, expect to put a dent into the huge problem that we have right now with drugs in the U.S. with fentanyl.
The opioid epidemic
Correct. So we're not going to solve the whole opioid problem. I mean, whomever wants to get high, I mean, they're going to find a way to get high. But what we are going to tackle, I mean, whomever needs the pain healing, something that they have to live day by day. There are people that live with pain that they cannot solve with ibuprofen and Tylenol. We want those people not to be succumb and going and look for the remedies on the streets. I mean, we want the doctors to be able to prescribe those without being afraid that they're going to be sued for people who, or somebody in their family who misused it, who abused it, and used it not as it prescribed. So we think that we're coming up with something extremely significant. This is just the first product. We already did the study of buprenorphine also, and that also came significant numbers, anywhere from 70 to 150 million. The same Advanced Health did the study for us. So that's going to be the next one. I don't believe the next one is going to take 4 years anymore to place it. We know the technology, we know the way. So the next one is going to be very fast. And this is just United States alone. We have worldwide patent on that. We have patent in 46 countries. So every major market in the world is covered. So that's our main product. That's what we expect to have on the market before the end of next year. And so if there was any excitement for anybody in our stock before, then now would be the moment to be really excited. If you also look at our stock, how it performed after the IPO, it's also different from any other biotech on the market since that they went public around the time that we went in 2021. I don't know, I don't want to say the number, but every company that I knew that went around with us, I mean, they were completely destroyed. And they were good companies too. I mean, some of them, I mean, they had extremely good product. Some of them even made the sales. I mean, they brought it to the market, but still their market cap was completely disseminated. And the only mistake, the only thing different that they did that we did not do, they went back to the same bankers to raise money. Or they went back to the market at all. We didn't. I mean, we understood right away that if we want to preserve our shareholder value, we'll have to stay away from the market. And that's what we did. We have our very loyal group of shareholders that have invested probably close to $20 million already in the company. And they're the only ones who are going to. So if our, let's say, insider ownership after the IPO was a little bit over 50%, I don't have the number right now. I'll have to look after this warrant conversion in July from our loyal investors, but I think it stays way over 70%.
Mm-hmm. So, you get those warrants at about 643, right? So
that's the price that the original warrants were. And
you got about 5.3 mil.
That's correct. And the original warrants, I mean, there's still about 800,000 outstanding from 2021. Most of them have been already exercised, but there's still outstanding warrants. Our loyal investors bought about a third of them, so they own those warrants. But still, there are about 500,000 that, institutions that are still using it, for the hedge, and their time is expiring. Is expiring soon. So I don't know how long they're going to be able to keep it up. But we believe that with the next milestones, we're gonna force their hand to convert, just like everybody else did.
So the way that it works, so it's going to be fast track. You only need like a phase 1. You don't need like phase 2 or 3 or.
Correct. That's news release that's coming up. Was discussed at the meeting last week. So that's still inside information. We're waiting for right now for written confirmation from FDA, and as soon as it's done, we're going to announce it to the market.
Right. Well, yeah, we have the disclaimer, all statements here for, forward looking or
correct.
things like that.
We just needed it to be reiterated at that meeting. So that's.
Yeah. Don't mean to jump the gun, but so what other goals and milestones do you hope to accomplish, over the next 6 months?
That's the most important thing. Over the next 6 months, first we're going to see that we're going to have another IND meeting right before moving to the hull study, because we need to make the production right now, the batch that's going to be used, and we're going to get to approval from the FDA to use unapproved product in the studies. We're going to have hull study. We expect to have it somewhere to start. It's not going to be over the holidays because it's going to be too expensive if we lose subjects. But it's going to be a study of about 30 to 40 people who are going to be presented a generic patch and our patch, and we're going to document which one they're going to be able to break in. And we kind of know the answer because we've done a lot of studies, and if regular patch on the market right now is as easy to get high from as chewing it. And with our, you have to be at least a minor in chemistry to be able to make a dent on that. So it's a very, very good protection on the patch. That study is supposed to take close to 3 months. So after that is done, we're going to prepare the documents and we're going to file with FDA. So those are the milestones. It's a very straightforward line from now on.
And perhaps you can, talk about your background experience, Sergey, and who the key management is.
At this point, I'm interim CEO. My partner is running for the president of Ireland. And I'm kind of relieved that he is the youngest one to ever got 2 council votes. He needed 2 more votes to get on the ballot, and it looks like yesterday, the main parties in Ireland have blocked him out. So he did not get the 2 necessary votes. So it looks like he's going to be coming back as the CEO of the company. I was feeling it for him. I am a president and the chairman of the company since the inception. And so we are the 2 founders of the company. Then the other key people in the company is Alan Smith, who is the inventor of AVERSA, and he's a chief operations officer, and he's in charge of all the project with Kindeva. Jeff Patrick, who is our chief science officer. Then we have the CFO Jerry Goodman, who's been in the company again since the very inception, since 2016, when we founded the company. And those are the key managers in the company.
So yeah, how would you say that management and shareholder interests, are aligned?
Well, since the company was founded in 2016, neither I nor my partner Gareth have sold 1 share. So that will tell you the confidence we have in this project, and our families are the largest shareholders. And whomever brought our loyal shareholders, they're all members of the family, so very, very close friends of ours. And they've been shareholders in the company since as early as 2016, some of them. The latest one that joined in the board in last year is he's a billionaire, came from also the country I'm original from Moldova. And he joined, Sergei Glinka joined the board last year. And he's one of the major shareholders now too in the company.
Great. Yeah. So right now, current share price 709, market cap at about 85 million. So before we conclude here, why do you believe investors should consider the company as a good investment opportunity at this point today?
Well, this is just very simple. Anybody who can do the math, basic math, can understand what it means here. I mean, let's say just 5% of biotechs make money. From those 5%, they trade anywhere from 40 to 300 PE, whomever make the money. Let's say fully diluted, just to make it easy to count. It's not going to be that, but let's say to make it easier to count, we're going to have 20 million shares at the end, at the time when the FDA is approving we'll have the product on the market. And let's say you make on the low end, let's say it's just 200 million, and we're going to put 50%, and we expect higher margins than that, and it's going to be 100 million. You divide it, that's $5 a share. Now multiply by 40, multiply by 80, or by 300. I mean, it's up to you, and you see what the price of the stock has to be. Also, bear in mind that there is one asterisk in that advanced health study. Should FDA make it mandatory, our revenue goes to close to $1 billion. And they might, because we're coming up with the safest patch on the market. And even if they don't, first, our patch is going to be a 20 to 30% premium to everybody else, as insurance companies are ready to pay. They already indicated that. Second, doctors are going to have a choice. Do they prescribe a regular fentanyl patch that anybody can chew and get high, or make tea out of it, or smoke it? Or do they prescribe a AVERSA technology patch? So that's why I was so confident, and why this project is so unique. We're coming up with something that nobody else has.
Well, yeah, we certainly look forward to continuing to track the company's growth and report on the upcoming progress. And we'd like to thank you for taking the time to join us today, Sergey, and introduce our investor audience to Nutriband Inc. It was great having you on.
All right, thank you.